Hello, and welcome to another Wellness Wednesday podcast. I have a wonderful, lovely Rachel here.
Thank you.
So, this is where we get to talk about something very, very, very important. This specifically is about hormones. And if you guys have, if you've heard about hormones and the importance of hormones, I want to basically tell you that everything that you know is, well, from the conventional model is, falls under the standards of care, and those standards are substandards. So what we're going to talk about is some common sense approach to hormones, what they are, what they do, how they do it. Of course, we're not going to get into that much detail. We only have an hour, and Rachel will keep me on target, of course, right?
That's the goal always.
Well, if possible,
We'll see
of
how
course.
well I
Yeah, I believe in you. Yeah. Rachel does have a way to put things in more common sense. So I do want to make sure to start out to say, what is holism? Holism is literally spirit, soul, mind, body. And this is very important to understand. Who is Rachel? Who am I? We are spiritual beings. We are spirit. We're soul. And there's a control center. Literally, there's a control center, the mind and the brain. And that control center then determines what happens with the patterns in our physical body. And part of the physical body patterns of the milieu is the hormones. That's one of the biggest things. There was actually an interesting discussion between the proponents of the germ theory, in other words, versus the terrain theory. And the concept here is very applicable. Feel free to jump in.
I was just thinking, so germ theory, if people are familiar with that, that's Louis Pasteur. That's how we ended up with pasteurized milk and those kinds of things. I think his, I don't think nemesis is the right word.
It could apply.
And I can't remember if the name was Beauchamp or whatever, but
yes.
I think at the end, Pasteur kind of
won. Yes.
But he conceded on his deathbed that he was not correct.
Correct. Absolutely. Yeah. Rachel, 100% on target.
Yeah. So sorry. Continue.
No. You're fine. Absolutely. So what does that mean? The environment, the milieu, the regulatory setting of what's happening inside our body, speaking of the physical body, is what determines the outcome. Now, you can chase this thing and that thing. There's all sorts of metabolic, blood pressure, diabetes, cholesterol, chronic pain, mental health, gut problems, lack of energy, lack of sex drive. I mean, just lots of different things. Lots of people are living a substandard life. They're living a life that's basically, lacking zest, lacking energy, lacking that spark. And what makes that spark? What allows us to truly enjoy ourselves? And if you watch kids, if you want young ones in general, now young generation is not so much spared either, because a lot of
screen time now and things. But, that's another topic for another day.
Whole other topic. Absolutely, we should talk about kids one day.
Okay, well, let's noted.
Noted. Okay. In my practice, in our practice, I noticed that over 90% of the patients, clients, actually have hormone problems. And that's sex hormones, male hormones, female hormones, stress hormones, and also metabolic hormones. We talked about metabolism and metabolic hormones.
Yeah, and so I think that's good to clarify for people that hormones is a huge ball of words, because like you said, metabolic hormones, so that can be things like insulin and glucagon. Sex hormones like testosterone and estrogen. I forgot what else you just said.
Progesterone. There's other things.
Oh yeah,
of course.
Yeah,
lots of
But hormones it's a huge piece of everything that's impacting our body.
Incredible. And it's central. If you really want to know what's driving the body, what allows the body to organize properly or improperly, it is really hormones. And where do hormones come from? Cholesterol. How's that? Now, we talk about cholesterol, and a lot of people are actually recommended cholesterol drugs, cholesterol-lowering drugs, statins.
Dr. Shealy feels very strongly about not doing statins. And sorry, go ahead and
explain the
reason why. Mm-hmm.
Quite so. Yeah. Actually, one of his favorite statements literally is, and he says that out loud, and I'll say the same thing. If you try to shove a statin down my throat, it's like basically I'm going to join Norm on this one. Both of us will basically will bite whatever hand is going to try to do that. I mean, and there is a reason for that. The most recent guidelines on cholesterol is literally to bring the total number down to even like something like 70 or less, or even less than that. And it's an interesting concept because some people actually believe that.
Well, and can I also,
Please.
from a nutritional standpoint, people get so caught up in, if I eat this particular food, I will have high cholesterol, which again, the association with high cholesterol, all of that isn't great to start with. But let me just be really clear. You could eat 0 cholesterol in your diet, not 1 drop, and you will still have cholesterol in your body. Your liver has to make it. If you don't have it, you will die. Cholesterol is vital for life.
And it's actually absolutely incredibly fascinating in that, okay, cholesterol, it's a precursor. It's a precursor to everything down the line. Cholesterol goes to, then there's pregnenolone, and then there is other steroid pathways. Down the path, we have all kinds of things. We have estrogens. Estrogens are actually, it's interesting. Estrogen is not just one kind of estrogen. It's 3 types. There is E1, there's E2, and there's E3. I'll talk about specifically E2, which is estradiol, which is one of the strongest and most bioactive forms of estrogen. And interestingly enough, and we're going to go general for now, both men and women have estrogen. Now, if you don't have enough, well, you're missing essential aspects because it works wonders in the right amounts in both men and women when it's proper. When it's low, people have trouble. When it's high, people have trouble. One of the biggest issues, and I'm probably getting ahead of myself, but one of the biggest issues in men, is not just the lack of testosterone, which is the most common thing that I hear, but it's actually the fact that testosterone is not just being made properly or enough, but it converts to estrogens. And it's that estrogen predominance, for instance, that creates all sorts of issues. Now, even something like prostate cancer. I was classically taught in my training that if a person has a risk or has been diagnosed with prostate cancer, then stay away from testosterone. Wrong. And this is the state of science. This is the state of the world that we live in. Why? Again, be careful, of course, in terms of what you do, and you have to work with the right person. But even in the setting of malignancy and prostate cancer, and you got to tread very carefully in those areas, and I usually do in consultation with the endocrinology and other specialists. But the idea is that it's excess estrogen causes the cancers, and it's the lack of testosterone that causes the problem, not having the testosterone itself. So let's talk about men and women. What do they have in common? What do they have different?
So let's, if you're okay with this, I think
please.
Maybe for our audience, let's back up, because you did say this, but I always like to make sure it's really clear, we're all on the same page. So, we talked about the first precursor is cholesterol, which for the most part is made in your liver. So we know that really taking good care of your liver is hugely important. So maybe later on we can discuss some ways to take care of your liver.
Absolutely.
And then, so cholesterol, we know it's made in the liver. It is a building block for your cell membrane. So again, you're going to see this in every piece of your body. We need it to make vitamin D, which was technically another hormone. So that fits in with the hormone thing. We need it to make fat dissolving bile acids. So essentially, we really need to be kind to our liver. But the reason I'm backing up to this is...
Absolutely. And one thing that I appreciate about Rachel is I like to cover everything all at once, just in one paragraph. But, Rachel comes from a background of teaching, so she actually can present me.
I just want to back up and go, okay, so we have cholesterol, right?
Yes.
And then Dr. Sorin said pregnenolone, because that cholesterol inside of your cellular mitochondria gets converted into pregnenolone. And then if you were looking at like a flow chart, you would see that now we have pregnenolone, and it is going to get converted by enzymes once it's in the cytoplasm into either DHEA or progesterone, right? And then from there, we go into all the other hormones we've talked about: cortisol, estrogen, testosterone. So just so people can go, estrogen, well, I don't know where that came from. Cholesterol, pregnenolone, right? And then we DHEA and progesterone.
Okay. Wonderful. Okay. Absolutely wonderful.
That way we're all, okay.
Rachel, thank you so much.
You absolutely. It may not have. I don't know.
It helped me.
Okay, perfect.
Yeah. The trouble is when you think of too many facts all at once, and everything wants to come out, But again, let's kind of take it in a stepwise progression. So let's talk about men and let's talk about women and what happens with all these things. So first and foremost, make sure that the diet and nutrition is proper. Make sure the digestion is proper. Make sure the liver is okay. Please.
Yeah, I was just going to say, maybe let's talk a little bit about how we support our liver, especially hormonally, especially sex hormones. We talk about compounds from broccoli. Those are wonderful. Cruciferous vegetables. If your liver is already a little, it hasn't been treated the best, maybe some, milk thistle can be a good thing. Dandelion.
NAC, glutathione. There's a number of things. And of course, the basics of the liver support and the general health is you've got to have a good B complex, such as Dr. Shealy's Essentials, at least 25 milligrams of most Bs. Why? Because that's ATP, that's energy production. You need energy for detoxification. You need energy for every cell action. Now, other things that are supporting support the hormones, and this is very basic, very basic. Everyone needs to be on that, whether you have a problem or you don't. This is just a normal, general, healthy way to keep your hormones and to keep your body milieu in a good place. Dr. Shealy's Essentials and Youth Formula. Youth Formula is vitamin C with MSM, raises DHEA by another 60%, in addition to magnesium topical, which raises DHEA by 60%. And then, of course, there's vitamin D, which is a hormone in itself. So that's our essential combination for every human being. So since we're talking about health and wellness, not just disease, but how things should be. So let's touch base on that, actually, as a matter of fact. So you got to have a good B complex. I'll just say it again: Essentials, Youth Formula, or a combination of vitamin C and MSM, if you can find it separately in the right amounts. There is vitamin D, there is magnesium. And in addition to that, there's other things that are important. For instance, how many people drink alcohol excessively? Let's talk about that. Now, I understand times are rough.
There's no judgment here.
There's no judgment. When we are under stress, we default to certain habits, and some habits are worse than others. Having alcohol, excessive alcohol, I'm not talking basically one glass a day or two of something that's, let's say, red wine or something that's, moderation. That will actually not only destroy the liver, but that will shut down and it will actually cause aromatization, which is a term for conversion of testosterone to estrogens. So if you're a male and you're a drinker and you have a beer belly or a gut, lots of extra pounds, adiposity, extra fat tissue. Let's say you're a male, I'll almost guarantee you your testosterone is going to be low. Your estrogen is going to be high. And you're going to have all sorts of problems.
I mean, kind of just to and correct me if I'm wrong here, but so people understand that when it goes down those pathways, it can either become testosterone or it can become estrogen. And so you need to, the body needs the right tools to make the right hormones.
Exactly. So, it's got to go somewhere. Mm-hmm. So basically just think of it as a Lego, Lego board. If you have a certain thing that you want to create, for instance, right? And then you don't have enough pieces for that, but you have the pieces left for other things. The body is really intelligent. The body is very smart. There's systems within subsystems. So if it's not making the right compound, it's going to make some kind of a compound to try to compensate. But the idea is compensation. At some point, compensation turns into discompensation or lack of compensation, and then you've got frank disease. And the frank disease related to the hormones, and I'm talking both men and women in general now, and then of course I'll break it down into further categories, is metabolic syndrome, and that's of course really related to the high resting insulin levels, basically, which is if you have that, How many people check their insulin levels? Fasting insulin, by the way. That's an interesting question.
And if you've got any kind of a spare tire, or there, you probably have an insulin problem.
I would say anyone who's got a diabetes, hypertension, or cholesterol, or any kind of metabolic issue, low energy, fatigue, just spare gut, anything of that nature, thyroid issues, you will find 99 or 90+%, I should say, I shouldn't say everybody, but there's a huge correlation with the hormone issues, whether it's inappropriate secretion or inappropriate conversion, or basically just not functioning right. And when these things are not functioning right, guess what? Your body doesn't function right. Because what is the function of the hormone? Sex hormones and otherwise. It literally regulates every organ and every cell in the body. There's receptors everywhere. So if you're sending the wrong messages, or if you're not sending the right messages, the body is an incredibly complicated, beautiful machinery. Amazing, but only when it works right. Imagine if you have a beautiful vehicle, a beautiful car, and you're literally just putting the wrong fluids and just the wrong settings and the wrong, you're not maintaining the inside. It could look nice on the outside, usually not, but.
So you know what though? That's something you should point out, because a lot of people go, well, I have this friend and they eat terrible and they look completely fine. They're not overweight. They're healthy. Mm-hmm. Asking them some more questions, because what we run into is they're not healthy, but it's manifested in a different way. So not everybody manifests the same problem the same way. Exactly.
Mm-hmm. And Rachel, I'm going to jump in here, because I certainly have seen plenty of thin, good-looking, so to speak, diabetics, blood pressure, lots of things, and especially hormone imbalances.
Mm-hmm. Yeah, I mean, the things that people don't see is these people can't sleep at night, or, they're very injury prone. And that also goes back to how everything's, how it's all connected. So yeah, there's a lot of, you can't just look at the surface on someone and say, well, they're healthy and they do all these kind of unhealthy choices. It does impact them. And also you can't worry about what other people are doing.
Kind of 100% on target, 100%. The other thing, Rachel, is let's touch base on some of the things that are, some of the aspects and the ratios. So again, I can talk in general, but then of course we'll get into more specific, and because men and women both have the same hormones. We all have estrogens. We all have the three types of estrogen, which gets interconverted between each other depending on how it gets metabolized.
Which gets largely metabolized in the liver and the gut.
Yes. So perfect. So you have a person with dysbiosis, or in other words, leaky gut, general toxicity, and again, you'll know yourself if you're eating mostly crap or a terrible diet, or you're not taking care of yourself, and you have frequent digestive issues, and otherwise. I'm also going to guarantee you that you're going to have hormone issues as well, because the gut is where everything gets metabolized for men and for women, and this is also where inflammation takes place. And by the way, hormones also help to keep control over inflammation in general for both men and women. So and inflammation is the name of the game now for basically the next decade, or maybe a century perhaps. Please feel free.
Yeah, no, I didn't know how specific we wanted to get, but you were kind of talking about like inflammation, hormonal imbalance. I mean, if we look at something like progesterone, right?
Yes.
So we know that it can oppose the toxic effects of too much estrogen. Of course, we need to have enough estrogen too. That's important. It's a balance. But if we have too much estrogen, some of the things that we deal with are cardiovascular disease,
polycystic ovarian syndrome, PCOS, diabeticity, weight gain, low
deposition, weight gain, same thing. Yeah.
Mental, emotional, mood, depression, anxiety, panic attacks. Everything, folks, everything. The whole system is completely interrelated. And then, of course, just on top of all that, the immune system. And of course, the gut is part of the immune system, huge part of that. But the immune system and the endocrine hormone system is absolutely connected. If the progesterone and estrogens are not in the proper balance, you actually get to shift the immune system from self-protecting to self-harming. and so on and so forth. And vice versa, the immune system disorder can activate and turn off the proper hormone processes as well. So the most interesting thing about this is when the body is working properly, things work well. When the body is not working properly, everything goes down. Everything. And that's when you have the chronic illness. That's where you have this concept of you get older, you get sick, you get chronic disease.
Well, and I think part of that too is because, like DHEA, we're kind of at our peak in our 20s, and then we don't make enough lifestyle diet choices to continue to support it, which I know you had talked about some things we can do to support.
Oh God, DHEA, absolutely. And by the way, I'm going to jump a little bit ahead of the schedule. But if you really want one of the best precursors to the hormones, and let the body do what it needs to do. In other words, give enough Lego pieces of material so that the body, the intelligent design, can actually take care of itself and give itself what it needs, not necessarily what we want it to give it, but what it needs to do on its own. DHEA is one of the best substances. DHEA is an anti-stress wellness hormone. It's a hormone formed and released through the adrenals. So there's a kidney, and then on the kidney there's cortisol that's being released, and also on the adrenal surface or adrenal aspect there's also DHEA. DHEA balances the cortisol. I know we're going to talk about sex hormones, but I think it's worth mentioning.
That's really important. And actually, I actually wrote some kind of fun stuff down about DHEA that gives people like some really concrete examples of what it does. A lot of this is on animals, of course, but I feel like it's safe to say we've seen a lot of this translate similar into humans.
Oh yeah.
So some mice that were genetically prone to obesity, right? So they kind of breed them to be that way.
Mm-hmm.
One of the things they figured out to make them lose weight was give them prolonged use of DHEA. And then in another breed of mice that was, of course, they breed these mice to be genetically predisposed to things. This one was to breast cancer. They figured out that the DHEA therapy helped prevent that. So again, these are mice, but it's an interesting concept to take away to know what a powerful hormone it is.
Absolutely. And obesity is not a benign fact. If you got a belly sticking out, or if you have excess weight, and I'm not talking about the number on the scale. I really am not. Rachel, you could be 300 or 400 pounds and have lots of muscle, which is really wonderful for you. And that's great. And again, if you're
7 feet tall.
That's right. And of course, in a professional, professional muscle builder. But otherwise, I mean, that's a big deal. Back in a little fun fact, back when I was in medical school, I actually did research. That's one of my first research projects, and it was literally had to do with obesity, not high-fat diet promotes colon cancer in rats.
Oh, well, that's interesting.
So I started out with metabolic. Actually, come to think of it, I almost forgot about that.
Yeah, well, that's interesting.
But not just rats. So we started talking about DHEA. We started talking about a couple of things. How do you raise DHEA? How do you give yourself the first opportunity to get out of the hole, so to speak, if you're under stress or if you need to make proper hormones? Well, a couple of things. We already talked about the basics, and which is why we mentioned that. Essentials, which is the B complex. Youth formula, which is if you're over 130 pounds, say, 4 capsules of vitamin C with MSM. That's Dr. Shealy's youth formula. Raises DHEA by 60% in combination with a B complex. But you have to have a B complex in order to have vitamin C, because otherwise you're going to burn out your B complex and you're going to end up in the worst place. So it's a complex. It's a regimen that goes together. Magnesium, we mentioned that raises DHEA by another 60%, but not magnesium by mouth, even though it's great for cleaning up and if you have constipation. But if you don't have constipation, and then magnesium chloride, that's topical and Dr. Shealy demonstrated DHEA enhancement by 60% on that alone. Now, there's 2 other factors that raise DHEA, which is naturally, without having to take it. And that's one of them is a bliss oil. It's called Fire Bliss, which helps endocrine system from thyroid to the pineal to adrenals to the sex hormones. But it literally also raises DHEA by 60%. and it helps with the mood, and it helps with a brain stabilization, depression, anxiety, stress, also inflammation, anti-inflammatory. But is that a surprise? Because DHEA has all those factors. DHEA is actually one of the most essential health hormones, and DHEA will be a precursor to many of the sex hormones that we're talking about. So you want to do something really good for yourself? Work on your DHEA.
And can I just say, start working on it in your 20s, and so you're not coming to us in your 60s and struggling with all of these things. Because that's.
By the time we, and it's okay. It's okay when we get somebody who's in their, let's say, later years and lots of every metabolic condition, every chronic illness under the sun, we will still make it better. Rachel works with this.
Yes, I mean, I'm not saying they can't be improved.
Of course.
Yes, absolutely.
But why?
Yeah.
Why wait?
Why even ever have to deal with it?
Exactly. Yeah. Why would you want to just let yourself go and just literally be in a place where you need to dig out to a great degree when you can stop digging before it gets too bad? In other words, and it all comes down to the fact that it's the human body is designed for health. The human body was not designed for illness or chronic disease. It's only in our society, in our culture, that we expect everyone over 30, so to speak, to have a metabolic condition or chronic illness or something.
Right, where it's considered the normal. It's not. It
abnormal.
Should not be normal.
The abnormal has become normal, and normal has become abnormal. Mm-hmm. And that's what bothers me as a holistic doc, because if you can control those things, if you can create a good homeostasis, a good system in our system. And I see there's a bunch of questions, and I'm happy to get into that. This might be an interesting session, by the way.
Yeah, I don't know if we're gonna.
Yeah, we'll get to as much of it as we can. Absolutely, but I do want to make sure that I cover this. Let's start with women. Let's start with women specifically, and women and the hormones. It is very, very important. It is very common that I see young ladies on birth control pills and things of that nature, and that's conjugated. That's not natural estrogens. Can it help? Yes, it can, especially with things, with things that are estrogen, where you need the help, but it's the wrong kind of help. It's the wrong kind of help, but metabolically wise. It's not right for the body. It's not right for the molecules. It's not right for the receptors. Yes, it does the job, but it's not exactly right.
Come with a risk of several side effects too.
Cancers, breast and uterine and otherwise, strokes, heart attacks. Yeah. And when you read about hormones, and if you talk to your conventional medicine doc, and I'm talking about women right now, but men, please listen carefully as well, because this is a factor as well. Everything I'm saying about women is to some degree applicable to men, and everything I'm talking about men is to some degree applicable to women. Humans have a lot more in common than difference. When a person comes into me on a birth control pill and they're having irregular cycles, or they're having weight gain or PCOS, in other words, polycystic ovarian syndrome, or any kind of diabeticity, insulin, or any chronic illness, the first question I ask: how can we get this person off birth control pill, and how can we, if we need to, initiate something called bioidentical hormones? But here's the thing. That is step number 2. Step number 1 is, have you optimized your lifestyle? Have you optimized your nutrition? And we can talk about that in a great detail. Have you optimized your activity and movement? Because the body needs that. Without that, things fall apart. Metabolism fall apart. We are meant to move. If you're not sleeping well, if you're not resting, if you're not recovering, how does the body work? Every organ resets and recovers. And it's, of course, responsive to the hormones. Every organ, there's not a cell in the body that doesn't have receptors for the hormones. It affects everything. Of course, different cells, different organs, they do different things. They respond differently, but it's a symphony. It's a coordination. The whole body is meant to sing as a one beautiful orchestra. And if it's not, well, I'm sure we all heard bad orchestras, and it doesn't sound good. I mean, you can get through it. I mean, I've been through a few.
I sat through a few elementary band concerts.
Yes, and especially if you have kids.
Mine included.
Oh God! And if you, thank you. Yeah, and I love kids. When you watch performances, but if you ever see a performance where with orchestra that is not coordinated, you'll know exactly what I'm talking about. And that's what's happening inside the body. Estrogen and progesterone have got to be balanced. In other words, too much estrogen, you got breast tenderness, you've got risk of malignancies, you've got risk of cardiovascular disease, you've got all sorts of mood and PMS type disorders, you've got metabolic and endocrine disorders. There's a huge association with the insulin resistance and hemoglobin A1C, but also every factor under the sun. So how do you put that? How do you replace it? How do you make this right? Other than lifestyle, well, the next step is to make sure that if you're going to be checking something, check it properly. How many people have had their hormones checked, and how many people have had their hormones include, at the very least, follicle stimulating hormone, FSH, LH, progesterone, estrogens, perhaps various aspects of estrogen, testosterone, free and total. What about, there's other things like, again, I'll just throw out the names of the tests. We don't have enough time to go through all of them. Prolactin levels, that can indicate a disorder or dysfunction. And I always check insulin levels. I always check for high sensitivity CRP and inflammatory markers. I check for the immunity. There's a number of things that we check as part of the functional panel. And that's not something that happens as part of the conventional. And if you do go to conventional, you're probably going to hear a very same boring story that hormones can be dangerous for you and can cause all kinds of problems. Of course they can, because those are hormones based on horses put into human bodies. Last I checked, humans are not horses, different species.
I think something also we should clarify is, so several of these tests can be done via blood and they're very good.
Yes.
But one of the things that we do here at the clinic is we utilize a very specific test. So we're not just, because blood can give us a snapshot, but you also have to remember blood is the superhighway and we need things to exit. We need to see how it's getting into the cell, how it's getting metabolized, how are these hormones getting used. So one of the tests that we use is very specific in that it's a saliva and a urine test, because that way we can see how it's going through your body, how it's getting processed, and we can follow the pathways. So that's something very specific that we do at the clinic.
Absolutely, and especially for women, but also for men. Now, just because the levels are proper, let's say estrogens, let's say certain level, progesterone certain level, testosterone certain level. Does it mean you're okay or not okay? No, that's not what it means. If you're not feeling well, guess what? Something is not okay. This is where all the metabolites, all the pathways, for example, in estrogen metabolism, there is E1, estrogen, E2 and E3. There's 3 forms of estrogens, and they all have different functions, different strength. E2, for example, estradiol is the strongest of the effects. But you have to have a ratio and combination of E1, E3, and E2. And if that ratio is not proper, it's not a question of how much or how little. It's not proper. Well, it is a question of how much or how little at that point, but it's off. That's the bottom line.
I mean, everything comes down to ratios.
Ratios,
really,
yeah.
Because, I mean, again, progesterone and estrogen also, like that.
Have to be in the ratio, balance. Testosterone, free and total. Also, testosterone in women, I'm still talking about women. Women have testosterone. It's lower ranges than men. Again, I mean, it's not the same, but it is essential. Without testosterone in women, that's your sex drive. That's your bones. If you have osteoporosis, it's most likely lack or failure of testosterone. Not so much even estrogen or progesterone, even though they do help to some degree. There's other things as well, including mood and otherwise. So sometimes all it takes is testosterone in women. Again, sometimes all it takes is a little progesterone if it's proper. Sometimes you need the whole combination. In other words, estrogen, progesterones, ratios of let's say E1 to E2 or otherwise, and sometimes you have a combination of 3, E1, E2, and E3 put together in a certain ratio. Again, it depends on a clinical case scenario, but it has to be bioidentical. What does bioidentical mean? Let's talk about that. Does it mean that it comes from a human body? It's derived from a human body? Not always. It's created to be the same as a human body. It's a lock and key. So when it goes to work, the idea is it needs to do the right thing in the right message. It has to be exactly human-based, and it has to be the right molecule. It has to be the right function. So that's why that's important. I don't put anybody on hormones, men or women, if it's again without consideration and making sure that it's as much bioidentical as possible. There's various ways to get it done. There's pellets, there is injections, there is creams, there's oral, and
I will say before you, I mean, you can also, and of course you can either do this as an adjunct or try it before, but there's diet and lifestyle can also make a big difference with hormones.
Yes.
And Dr. Sorin, you have a lot of questions.
So we do. I'm
going to keep you on track with that.
Yes, ma'am.
Maybe let's go ahead.
So maybe we'll close up a little sooner on this and just get to questions, because there's a lot of questions here and it's wonderful. I do want to talk briefly about men, because men. No, absolutely, yeah. I do want to say this because this is the first program that I started was actually simply T. It was or basically the hormone support for men. T stands for testosterone, and the reason I called it simply T is because I really wanted to get to a place where I wanted to find an easy, simple, and yet effective way to support the hormones in men, and I was client number one. I'm in my late 40s now, and I discovered a number of years ago that I was literally losing my sex drive. I was losing my energy. I started gaining weight, and I was still working out somewhat. So, I mean, I haven't changed my routine, but my body was changing. My mind was changing. So that's when I said as a doctor, hey, what's going on? And then something clicked in, and I checked my hormones just out of the blue. And my testosterone was literally in the dumpster, literally. It was like at a level of 200. And it's a miracle I was even functioning. Now, what happened was I did the research. So I figured a different way to give myself the testosterone, so supplementation properly, and to monitor that. And that was the basis for formation of the program. Since then, I've been having lots of people from 90s to 20s, or 20s to 90s, I should say, all sorts of medical conditions. And the sicker you are, the more hormones are helpful, by the way. Because the sicker you are, the more dysfunction in the body. So the other interesting thing that I noticed is not only did my own function come back to normal, and I just literally woke up and said, "Hey, where have I been this whole time?" Is that we discovered, and my wife is not here, Lindy, but she does come on the show with me, and she's happy to talk about this because when I woke up, she was still asleep. So there was a huge discrepancy between me and her. And we started getting into arguments and fights because, just verbal and mental and emotional. Why? Because I was now feeling better and she was still in a low hormone state. So that's when I said to myself, if I'm going to treat a male, or if I'm going to take care of myself, I got to make sure that I treat the wife. I got to make sure that that both people are on the same plan, because if a husband is optimized and the wife is not, or if the wife is optimized and the husband is not, one has sex drive, the other doesn't, that could be dangerous. That could be dangerous. So I want to make sure that the whole family is on the same page, because it does take the whole family health. But of course, it's also individual. And in men, it's not just it's not just the testosterone, but it's also other things. And we want to make sure that the conversion of testosterone to estrogen is proper. We want to make sure to protect with that. We want to make sure to optimize body's internal testosterone production. And I use something called Clomid, or sometimes a substance called DIM. It depends on the situation. But the idea is, YAMs have been shown to be helpful, but not as helpful as some of the medications. There's lots of ways to decrease the conversion and optimize the body's own internal production of the hormones. The bottom line on all of that is that if you're going to run a program, make sure you run the program the right way. Make sure you test properly. Make sure you check in, and don't just depend on the blood work, on the lab results. I never treat lab results by itself. If somebody is low and feeling well, it may work for them. That's all right. If somebody's high and it works for them and they're doing fantastic and no other physiological markers, guess what? The 95% interval on the lab is literally that what it is, 95%. What if a person is on the outlier? In other words, in that other 5%, I've seen plenty of that. You treat the person. You don't treat the number, but the number helps. It supports. And it's literally going from the head down. It's mental, emotional focus, drive, concentration. It's not just the muscles. It's not just the workouts. It's not just it's the mood. It's the organ functions. It's cardiovascular. It's literally reversal of diabetes, hypertension, cholesterol. Now, of course, it takes lifestyle and diet and good habits, staying away from alcohol, staying away from harmful things, making sure you're on good supplements. Stress management is a huge part of it. But literally, you can turn a man who is withering away, and there's a name for this as well. There's a women have something called menopause. Men have something called andropause. And if you are a male and you're feeling crappy and you're not like you're like where you were before, think about it. Think about it. If a doctor tells you you're fine or you're appropriate for age or you're just basically dying, withering away, and that's exactly what's expected from you from society, if you're okay with that, okay. I'm not okay with that. Let's put it that way. I'm not okay with that because I believe that humans are actually, well, we have a lot more potential and we have a lot more power and capacity. And if we optimize ourselves, if we optimize the internal environment, including hormones, but along the same lines, thyroid. I never speak of hormones without speaking of thyroid because that's the driving belt behind the whole thing as well. And the gut. And of course, then you get into immunity and lots of other things, but that's when you get to system within subsystems, bigger systems, and then family systems and societal systems. Holism is everywhere. But we can go into a lot of different things, and we're going to have a number of talks about this because this is what I do for a living. This is what turns me on. This is what makes me happy. And that's how I help the most people, other than, of course, spirit, soul, mind, body, realization that we are spiritual beings. We have a control center. We can do something about these patterns of the physical body, and we can, and we should. Now, Rachel, what do you think? Shall we go to questions or should we continue?
Well, I think let's go to questions.
Okay, because we've got a lot of questions. Mm-hmm. Okay, so all right. So I don't know if Matt can scroll back up and we can address it the questions there, or I can just let's see. I've got another way of. Okay, I've got something here. Question 1. Oh, okay. Is that?
He's getting there.
All right, perfect. I'll just read here. For any recommended readings for somebody starting medical school? Absolutely. Please look at some of Dr. Shealy's books because he literally outlines some of the factors. One of the books that he has, the title is quite contrary. It's and it's literally called Third Party Rape. And it's a strong word. It's a strong name for a book, but it's literally outlines what Dr. Shealy has discovered, and it's just getting worse and worse in terms of what is happening in the healthcare system, insurance system, and how the entire system is corrupted and otherwise compromised. Of course, stay tuned to with our program. But literally, the way I look at the medical system is this. I'm not angry with the medical system. I'm not frustrated with the medical system. I'm wearing a stethoscope. I got a white coat. Hey, I've earned my doctor's degree, and there's some good things that are very, very good about medicine, you know, especially acute care and chronic illness if you need that kind of help. The idea is it's a business model. This is what we need to understand. If you're going to go into medicine, and if I were to advise, let's say, family or kids whether to go into medicine or not, I would say think very carefully because the environment, the milieu is very, very dangerous and not conducive to what I originally came into medicine for, which is healing, literally. Keep an open mind. But if you do become a doctor, make sure you keep your heart. Make sure you keep your heart. There's another great book that was really a favorite of mine. It's called The House of God. House of God. And it really talks about, in a funny and humorous way, all the different practices of medicine back in the 50s. And guess what? Things haven't changed. They're just getting stronger and more so. Now, if you do go to the medical school, absolutely go to medical school, become the best doctor you can, pass all the tests. But remember, there's a lot more than what you're learning. Keep it in mind. Keep your heart, keep your mind, keep pure. And when you get out, do the right thing. That's all I can say. And if you, this is what it's all about. Now, and God bless. God bless. Now, another question. Any thoughts on continuous glucose monitors, breath ketone monitors, and stuff like that? Absolutely. Rachel.
Yeah, so I am a huge fan of the continuous glucose monitors. I don't think they're good long-term because you are hooked up to your phone essentially. So I don't love it for, I don't think that you want to be doing that for 6 months to a year. But if you can get a really nice snapshot all day long for several weeks, maybe like a month, of how foods are affecting you and how they are influencing your blood sugar, I think it's a really nice tool to help a lot of the things that we think are doing okay for our body. What I find with clients is when they play around with that, they're like, this is not good for my body. It doesn't respond well. And it's always nice to have immediate feedback to really help drive decision making. Yes. Same thing with the ketone, whether you're doing urine strips or a blood ketone, if that's your goal, if you're trying to get into ketosis, I just feel like having that solid feedback is such a nice tool for driving behavioral changes. So
exactly.
Yeah.
If you, how do you change something if you don't know where you are? Mm-hmm. That's the bottom line. And the biggest thing about life is patterns. The way I look at everything is, and this is a functional medicine perspective, it's not just an emergency room perspective or family medicine that I was trained in. And the holistic aspect, of course, takes that into account. It all comes together. It all comes together. Let's if you can identify patterns, if you can figure out where you are, you can figure out if you're happy there or not. If it's good for you, you can consult with the right people. And I recommend a holistic doctor, not a conventional doctor. But of course, if you work with what you got. And we work with people all over the world. Really, literally, about a quarter of my consults recently have been from out of the country.
Yeah. Borders do not impact
health and humans. People in China, people in New Zealand, people in Australia, South Africa, Europe. They have the similar physiology as people in North America. And by the way, similar issues with obesity and hormones and everything else. And it's become universal. The health issues have become universal, and so has health solutions. Okay. So next question, I think. Wonderful. Thank you so much. Thank you. I had my ovaries and fallopian tubes removed because I am a BRCA like my late father. Okay. Sorry to hear that. That's I'm going to be 55 years young. Thank you. I want to stop right there. That, Jennifer, God bless you. That is exactly the attitude and the approach that it's going to take to get healthy. Because if you were to say it old, I would correct you on that right there. Appreciate you. God bless. Is there anything you recommend, please, or no? Absolutely. Now, if you had BRCA genes, genome, and that's positive, that's a risk for cancer. There is a risk for malignancy. There is a risk for hormonal issues. Now, low hormones and improper hormones, the ratio of hormones is going to affect it highly. So even if you actually, can we scroll down, please? I just wanted to see another quick part of that question, if we can. Yep, there we are.
So anything you
no, it's okay. Yep. Yep. So just stay there for a second. So ovaries and fallopian tubes removed. So that means, right, at this point, you're not making any, or for the most part, progesterone or estrogens, and you do make a little bit some of that from the adrenals. Testosterone is usually less affected, but this is where I would want you to have not only the blood testing, which is usually something which is covered by insurances to a large degree, sometimes I should say, but this is where this dried urine test, such as Dutch test or any variety of similar testing, functional testing, will be highly essential, because not only do we want to see what you're doing with your current hormones, and if you're low or metabolizing in the improper capacity. Interesting thing, and I'm going to get into a little detail here, but I don't want to get into too deep. But from estrogen metabolism, for example, from E1, which is a type of estrogen, as opposed to estradiol, there's 3 of them, there's actually a ratio of how things are converted. And you can have either 2-hydroxy molecule that's formed, that's one pathway, and that's the preferred pathway, but there is also 4-hydroxy pathways when things are not being hydroxylated properly, which is a type of a chemical reaction. And that's what happens when we don't take care of ourselves, or we have some genetic abnormalities. And that's a predisposition to cancer and malignancies and all kinds of oxidative and DNA damage. So that's why doing those tests is very important. If you know where you are, and you have the right person to work with you and to analyze that and to correct it properly, you can literally prevent cancers. And so the other part of this is epigenetics, and I think you would appreciate this probably, is just because you have the genes doesn't mean you're going to turn them on.
So
it's what we do.
Your environment is what either silences a gene or activates a gene. So many of the choices we make are what determine whether a gene gets expressed.
Wonderful. Absolutely. And by the way, I see a comment. Hello from New York. I just came to New York, and I've got to tell you, I had the most wonderful time with my family. My mom, my aunt, she's 96 years old. Her name is Lyubov, which is in Russian, which means love. So I literally came home to love. And I learned so much about my family. I learned so much about my past. Just make a quick comment here. I want to say thank you to everyone that to my family, to the elders. And if you still have elders in your family, ask them, talk to them about your history, the family history, anything that bothers you, because there's things that I inherited from my childhood, my perceptions, the guilt, the issues, the problems that led me down the course of discovery, and it was blessing in disguise. But a lot of problems that I grew up with or so perceived, and growing up as a kid, I misunderstood a lot of things. So if you can clarify from the previous generations, or just to kind of put your mind at ease and talk to your family, and just it's essential. The elders are absolutely incredible value, incredible resource. And what do? We stick them in nursing homes, and we don't talk to them because they're old. I'm just going to say wrong. That's the greatest gold, silver, diamonds, resource in the world, in the universe. Okay, let's continue. I'm getting off my soapbox. Okay, there is a DHEA hormone guidebook. Okay, that is a wonderful resource on how you can optimize DHEA, and you can also work with hormones without having to talk to a doctor. But of course, if you find that once you take care of the essentials and the basics, you do want to talk to a doctor if you still have any questions, because this is where guidance is essential, and it can do a lot of great things. Now, I have a next comment. Now, we can have a little fun with that one. What about dioxins? Ooh. Okay, I'm going to be very careful with this topic because this is a very heated topic. I believe dioxin is a term or a compound that referred to the recent train derailment and the burning of vinyl chloride, and the molecules that came out is dioxins. Dioxin is an environmental poison. In the tiniest of the molecules, parts per million and beyond, it can cause cancers. It can cause lots of bad things. It can cause hormone dysregulation, hormone imbalances. And from what I understand, entire areas and parts of Ohio are affected. I will say this, and again, I'm just going to speak my truth because that's what I do. No matter what, I'm going to speak my truth, whether, no matter how it's perceived or not. When I was born, and raised in the former Soviet Russia, we were exposed to Chernobyl, which is a nuclear accident. And the government, in its infinite wisdom, literally made everybody stay home. So we were exposed for a long time as a family to this flow of radiation. And the official storyline was, folks, there's nothing to worry about, there's nothing to see, stay home, do what you normally do, and don't worry about it. Well, my entire family in the former Soviet literally died out from thyroid cancers and all sorts of malignancies, and at some point I developed colon cancer, which again may or may not be related to that, in remission now. So folks, if you're in that area, please don't listen to the authorities if they tell you to stay home and nothing changed, and use common sense. And if you're not feeling well, and if you have other options, please consider health and wellness, because it's not just the air, it's the food, it's the soil, it's the there's lots we can talk about here, but please, this is a big deal. Okay. Let's see. Let's go to the next question, please. How do you test for those markers? Okay, that's
in regards to hormonal markers.
Oh, hormonal markers. Wonderful. For men, I prefer blood work, because that tells you that gives you a general number, general line. Where's your testosterone? Where's your estrogen? Where's your progesterone? But again, it doesn't tell you the whole story. It doesn't tell you what your cells, what your body does with it. That's why when if there's a question or a person has clinical situation or clinical symptoms or concerns that are concerning or significant with hormone imbalance, you can really just basically tell from a history when somebody is okay or not. There's certain patterns that kind of go with disorder, dysregulation, and regulation. And when things go very well, you'll know it. You'll feel really good. So this is where the urine testing and the metabolites come in to see what's going on. Please.
Because if somebody's trying to figure out where to go have this test, where to do this
test.
Of course. I mean, they can go somewhere local, of course. If they can. Yeah. Sometimes it's harder to find this exact thing. You don't have to be local to have us order a test for you, have Dr. Sorin look at and interpret the results and tell you what you need and how you need to do it.
Thank you.
That is just, I know sometimes we're like, well, where do I go? Well, we are an option.
Wonderful. And how to solve the Shealy-Sorin way? Wonderful. That's it. Okay. Wonderful. Yeah. So basically, okay, and we'll get to the metformin question there, but that goes with metformin. Okay, yeah. Got it. Okay. I did want to mention briefly, if you want to work with us, I'm honored to work with you. And I do work with people in hormones in even different countries. You just can't prescribe it necessarily, but I can certainly recommend. I can talk about what is good, what is not good, what to watch out for. But if you're in the United States, I've worked with basically people from all over. And it's usually telephone or Skype. Some people fly in, and Springfield's a nice, pleasant town. You don't have to necessarily, depending on what we do. And well, that's a big thing. And I'm honored to work with folks. The only thing is that I believe my up to April now. New
so
visits,
we are booked out until the end of April.
But if something is an emergency, I'm sure we can do something to find a spot. It's just getting a little harder. Okay, let's talk about diabetes and metformin. Metformin is one of those drugs that I don't mind as much as some of the others, but it does have GI side effects. Significant GI side effects. And if you don't have to be on a drug, I prefer to be on no drugs whatsoever.
Yes. Can we talk about one of the side effects that kind of goes hand in hand with diabetes? So a lot of people end up with diabetic neuropathies.
Mm-hmm.
Metformin will cause a B12 deficiency. A B12 deficiency will also cause neuropathy. So,
Exactly.
I feel like people should know these things.
Common sense, but it's really, how many folks talk to your primary care physician or even endocrinologist, and how many folks, get the information the way that we're presenting it right now, or this kind of information? And here's the thing: I went through endocrinology. I took, during the training, I even took extra training myself in the conventional endocrine system. I just found something to be missing, and I couldn't put my finger on it. And the fact of the matter is, the conventional system is substandard. I have no problem saying that. Now, let's continue. I love what you said about husband and wife both being on the same health level. Amen. Because otherwise, I'm just going to say it this way. If the husband, let's say, or the wife is on a higher level, let's say sex drive, health, wellness, mood, and the other person is just totally miserable, falling apart, whether it's body shape, mood, emotions, lack of energy, lack of just complete dysregulation, complete metabolic mess, that doesn't do well. So both people need to get on the same page, and families need to work together. That's how I see the most success. It's not very common that, let's say, one person in the relationship will do well without the other person joining the effort. It's possible. Don't get me wrong.
And I'll be honest, sometimes what we see is when the other person does do very well on their own without the support of the other person, they end up going their way.
Exactly.
That's just a harsh reality. If that's what happens.
And unfortunately, you're right. I've seen at least a couple of divorces, and through the time of our practice, and not because of lack of opportunity, because I've actually said to the family, hey, I'm glad one person is feeling better, but you both have to be on the same page. Think about it, folks. And preferably the same page on a higher level, not on a lower level.
Right.
Yeah.
Same healthy page. And
why not? Okay, we have another question here. I am glad you mentioned the thyroid. I'm scheduled for parathyroid surgery in April. I've been told this could stop production of kidney stones. Possibly.
Also, that it could increase my libido.
Is that true? Okay, thyroid and the hormones, sex hormones, male and female hormones, and the stress hormones and the insulin and the metabolic hormones, 100% relation. I don't check the hormones without checking thyroid. I don't check thyroid without checking hormones in general. It's part of the picture. Now, unless, of course, there's a specific focal thing and the other aspect has already been properly checked out. But to me, a proper metabolic panel, when I see a patient, I look at it very strictly from this perspective. How are the hormones doing? How is the thyroid doing, which is part of the hormones? How is the general metabolic health, including checking the fasting insulin, hemoglobin A1C, inflammatory markers, homocysteine, high sensitivity CRP, lots of other things. Where are things? Where's the immune system? Where's the, what kind of chronic metabolic issues does a person have, or does a person not have?
Dr. Sorin, if this were your particular patient,
yes,
how would you feel about this parathyroid surgery?
Parathyroid surgery, it may help. It may help because parathyroid is about calcium. But as long as the thyroid itself is not affected, because in some surgeries, and please clarify, and this is what I do as consulting, in other words, even if I don't do the surgery or even if I talk to somebody in another country, this is just general basic advice. Talk to the surgeon and find out the extent and the scope of what they want to do. In other words, if they need to cut something in the neck, what are the chances that there's going to be thyroid malfunction? What are the chances that there's going to be a need for supplementation for certain things? Again, it's easy enough to cut something out, and there's a time and a place for everything, but it's got to be pros and cons. And so what I would do is I would put the situation together clinically and then say, okay, given this case scenario, can we do things holistically? Can we do things in a way that can avoid surgical procedures? Because if you can avoid it, stay away from it. If you can't, you know what? That's okay. But the risk benefit has to be more in the benefit than risk. And we do see patients, and I'm happy to do a consultation. So the number, by the way, to the clinic, if there's interest to set up a consult, is 417-351-5221. And could be Skype, can be telephone, can be in person. Otherwise, okay, let me actually get to the next question. Oh, stop scrolling for a sec, please. Let's go up again. One slightly up.
That wasn't a question. That was
a
statement.
That was a statement.
It was a very nice statement.
Okay, I don't want to read the statement. It caught my attention at some point, but after we address this question, of course. So what supplemental support does adrenal... what supplements support adrenal production? I tested... one more time. You're a little too fast for me right there, friend. Okay, I tested via blood test and saliva test adrenal exhaustion. Boom. Okay, now what does it mean, adrenal exhaustion? Adrenal exhaustion, there's 3 stages of adrenal fatigue, so to speak. But there's never such thing as the end game, because all it is reset and reestablish the pattern, reestablish the body, reestablish the brain, the hypothalamic pituitary adrenal axis. And that includes the combination of the coming down into the cortisol versus DHEA. DHEA is usually there to keep up with the cortisol on the stress, and then at some point, stage 2, DHEA starts to go down. Cortisol is still up, so we're still responding to stress. Stage 3, cortisol drops, you got nothing. You could literally be standing in the middle of the street, the bus is coming at you, and you're just literally saying, metaphorically or not, hey, I got no energy, I got nothing left, I'm not going to move. So that's where the cortisol is important, but the DHEA is there to keep up with the cortisol. So that's why DHEA is so essential. And so when you have adrenal burnout, adrenal exhaustion, it's a question of working with a mental and emotional, such as biogenics, autogenic training. Literally, with a mental and emotional resetting, retraining, biofeedback, you can reset without any external devices to a large degree. If you listen and you do this right, Dr. Shealy's biogenics system for self-regulation, autogenics, we've talked about that. There's other things that support it. For example, PEMF raises the ATP production, increases and improves cellular function. You improve cellular function, you change the patterns, you stop, you stop doing crappy things that we do as humans, you clean up the system, just the short of it, and start getting back to health. It's not over.
Just say,
please,
from a female perspective, we tend
please.
to overdo it. And that will also, in this case, less is more. Like that needs to be a lifestyle motto until you're kind of back to where you need to be. Less is definitely more. I don't know if that's exercising. I don't know if that's taking on responsibilities, but that is a huge part of how we burn ourselves out.
Exactly. And I know we're going beyond the hour, but I think I want to keep on going here. This is a wonderful show. And I do want to mention as well that there is no such thing as adrenal exhaustion beyond repair. It's just a question of, if it's been a long time to get there, it's going to take a long time to get back. But it's going to take a lifetime of changes, and it doesn't matter how old you are. You can be 90 years old. I've seen that. You can get better. Okay, I want to see the comment. Okay, wonderful. I released my anger and disappointment of the American healthcare system. Let's see that, please. This morning, and the universe guided me to you. I am honored and grateful. Thank you, and I am honored. Now, let me talk about the healthcare system. For the longest time, I was fuming. I was angry. I was frustrated. I was basically beating my head against the wall, and every single wall that I could see, just trying to change the system, until I realized something. Dr. Shealy is right. The system is not the solution. The system is the problem. The system is the problem. But look at it this way. What do we talk about the system? Pharmacomafia, pharmacoeducation, literally, it's a business model. It's a sickness, chronic illness business model. It's not about the patient. It's not about your health. It's about how you can basically, well, still be functional enough to work, not necessarily healthy and happy, but at the same time feeding the healthcare system and being dependent on the healthcare system and the drugs and the surgeries and all of this chronic care. You don't want that. I don't want that. I don't want that for you. But at the same time, we can't be angry at the system. We cannot. We could, but what's the point? Let's do something individually. And when each and every of us, and Jennifer, for example, myself, Rachel, and everyone, let's say here, who's listening, say theoretically, hypothetically, you've done incredible work on yourself. You cleaned up. You're a shining light. You're taking care of yourself. You're healthy. You're happy. You're an example for others. Enough people do that, the system is going to change. It's a business model. It's going to have to respond. But we cannot be angry. We cannot waste our energy. We cannot waste our precious resources. And the control center has got to be positive. We got to be in control. Thank you. Thank you. Thank you. Okay, now let's continue. What is the best thing for skin sensitivity? Ooh, skin sensitivity. I deal with all sorts of folks that are sensitive to foods, sensitive to supplements. They can't even take a B complex, sensitive to skin. I bet you there's hormone issue there going on. I bet you there's a gut biome issue going on. I bet you there's a thyroid issue going on. I bet you there's lots of other stuff going on. I bet you the immunity is in the self-destructive as opposed to self-protective mode. There's a lot of things there. But all it is literally is go under the hood, so to speak, look what's going on, change some basic patterns, lifestyle, stress solutions, and start working from the inside while supporting and checking out what's happening in the meantime. Please.
Well, yeah, healing is a healing process. It works from the inside to the outside.
Yes.
So.
Yeah, absolutely. Let's keep going there, and let's see if there's any other questions. Unless there's this is it. And I do want to say, do we have something else?
Nope.
Thank you. Well, thank you as well. I want to say, I do want to say from the bottom of my heart, to me, the opportunity to present, the opportunity to talk, to speak my heart, to speak my mind, to speak my soul, to speak my truth, light, love, it's priceless. Because again, if a tree falls in the forest and nobody hears it, did it really fall? Well, there's so many answers to that one. But our goal at Shealy-Sorin Wellness, and starting from Dr. Shealy himself, is to make the world a better place. We can only do that by education and empowerment. And again, if somebody wants to become a patient directly, that's fantastic. But start with knowledge. Start with foundation and start with the basics. And if you do nothing else, Start with a lifestyle. Start with stress management, autogenic training, biogenics. Look at PMF as a cellular supporter. And if you're looking at a consult or you want to go deeper, absolutely, it's wonderful. Wonderful. Okay, let's see. Another one. Blessings to every single one of you. I agree with that. Blessings is my favorite saying. And there's a reason for that, by the way, because every single second is a blessing. Every single opportunity to be of service is a blessing. Every single second to be alive is a blessing. It's wonderful. It's wonderful.
What a wonderful way to wrap up this episode.
Absolutely. Yeah. Okay, so let's see. Wonderful, wonderful, wonderful. So I do want to say before we end there is a coupon code for 15% off everything in the store, and it's called LOVE, LOVE 2023. Including PEMF, 15% off, and all the supplements and everything that we do. And if you want to support us, and it will be highly, highly appreciated. Of course, Dr. Shealy has always been about doing the right thing and putting just the right and the quality products and supplements out there, and combinations and protocols that we have put together. They've been around for decades. So you're literally getting the benefit of everything Dr. Shealy has put together, and now we are actually made it easier. So please check out the store if you like, and certainly appreciate you because the message that we bring to you comes from the heart. And Dr. Shealy couldn't be here, but he certainly sends his love, and he's doing great, by the way.
He's getting ready to start his garden. So,
oh yeah, and a few appointments here and there. So again, LOVE 2023, 15% off everything in the store. Real Holistic Doc. And I do want to mention a few other things. For appreciation for our supporters and friends here in town, Spring Valley, wonderful store, Dr. Shealy's favorite, great service, and they carry some of his favorites, including Essentials, Youth Formula, Bliss Oils, Magnesium Lotion, and lots of other stuff. And last but not least, cherry, concentrated cherry juice with basically two tablespoons. That's you can do more than that. Fantastic antioxidants, good for you, great for metabolism, and it tastes good. Dr. Shealy's been doing it for years. I've started doing it myself when I met him, and I plan to continue. So if you're not getting your veggies, make sure you do that. Tart cherry juice concentrate. So if there's any other questions, and I would love to get to a lot more, but I think what I'd like to do is we'll save a little bit for the next time, and we still have a lot to talk about on hormones. I want to talk in the cover about the stress cascade and what happens with stress. People say stress. It's just stress, nothing to it. Or I'm always stressed, or I have no stress. Now, that's an interesting one. I have no stress, and the person's shaking in their skin. Great, absolutely. Perception, reality. Well, bottom line is there's something called hypothalamic pituitary adrenal axis, and that is basically down into the cortisol versus DHEA, and we'll address that. Yes. Yeah. We don't want to go another hour right now, continuous, right? Or we want to say
all night.
All night. I could really talk about these topics all day. It just makes me happy. Lots to discuss. Rachel is fantastic to talk about metabolism, insulin, diabetes, hypertension, lots of stuff. Got a lot to cover. But bottom line is lots to bring you. And join us next time for another wonderful Wellness Wednesday podcast. And Rachel, it is wonderful to have you.
Thank you for having me.
It is a pleasure. It is an honor. Thank you, everyone. Blessings. Take care. Stay healthy. Stay good. And if you have any questions, feel free to get in touch with us. We'll put some information in there. And again, Real Holistic Doc, 417-351-5221. If you're interested in working with a holistic doc, Real Holistic Doc on hormones or any other health issues. And of course, if you have somebody local and you want just a second opinion or whichever way, the information is out there. And health is out there, and we want it to be you. We want you to be healthy, happy, and absolutely amazing. Take care, folks.